All right. Hey guys, Dr. Lobacz here. My goal with this is to create an idea so that you understand what chiropractic is. And before you even come into the office, you know what it is we're about. So, what I want to do is kind of go through the foundations of chiropractic so that you understand what exactly is going on and that we can get a better concept that we can work together with. So, let's go ahead and go to the next slide here. These are the four most common questions people ask when they come in my office. So the first one is, what is wrong with me? Can you fix it? How long is it going to take? And how much is it going to cost me? And I think that's all reasonable questions. So we're going to go into those a little bit at a time here. But the first thing I want you to understand is your most important asset better be your health. Because if it's not, there's nothing left. Like, you could go make a ton of money. You could have nice cars. You go on vacations, but if you don't have your health, you can't do any of these things. So you've got to take care of your health. That is the foundation thing. So let's talk about what is health. Are you healthy if you just don't feel good? Or if you do feel good, does that mean that you're healthy? I don't think that's really the right answer. It's one step to it, but if we were to actually define health, this is what it says. Health is a state of complete physical, mental, and social well-being, and not merely the absence or disease or infirmity. So it doesn't mean that you're healthy just because you feel good, or maybe you look a certain way, or maybe you know a guy at the gym or in your neighborhood or at your office, and he looks a certain way, and you assume because he looks like this that he's healthy. I think that's a very, very big problem. So, we need to look at this and say, what is health? And so when we look at health, we want to look at it from a chiropractic viewpoint. And so what does that mean exactly? Well, if you take a Tylenol and your headache gets better, does that mean that you are deficient in Tylenol? No. It means that your body can block those pain signals when you take a drug. So the big chiropractic message is we run off of something called the 3 T's. The first one is trauma. And everyone's had trauma in their lives, whether it's been, you fell off a trampoline, or your bike as a kid, or you fell down the stairs, or were you in a car wreck, something. We all have trauma. The second one is toxins, and toxins could be anything from fried foods that you're eating, or it could be too much sugar in your diet, or you could be, who knows what, too much alcohol, right? You're fatty, you get a fatty liver. There could be all kinds of things that are causing toxins coming into your body that you need to kind of like clean out. So that's a lifestyle issue that I think we need to address when people come into the office. What are the toxins? What are you doing that we can detoxify out of your system? And the last one's thoughts. And you'd be surprised how much stress, especially after dealing with thousands of women come through my office. Stress is a killer, and it makes people sick, frankly. Like, I've seen trigger points where we have muscles and they get these little spots in them, and they can cause, those trigger points can like really irritate and sometimes even cause headaches and cause problems. So it's these little problems that our bodies have that we've got to like kind of clear out. So usually, and I say women earlier, men can still get, stress and thoughts and cause stress in the body. But when we put the three of these together and we elevate them up to a higher level, that's when we really see people get healthier. So that's something I want you to think about. It's not just a lack of Tylenol or a lack of any drug. It's about getting the body healthier from, these three kind of pillars. So the first thing we do when you come into the office is we want to check your spine for issues. And we use something called a Tytron Scan. And basically what it is the little scanner that we run up your spine. You can kind of see these like collars on the side. And you can see over here where it says like normal, mild, moderate, and severe. These kind of look like, to me, it's like a stoplight. So green is kind of what we want to see. We want to see green on both sides, and that's a good thing. As we see the yellow, orange, and red, it tells us, hey, there's some inflammation in these areas. So these are the areas that we're going to kind of address first and kind of look at. So there's no possible way that your body can work well. Like if you come into me with headaches, let's use this example. You come to me with headaches and your neck is all lit up and it's angry. Well, it's not a deficiency of Tylenol in the system, right? Like we're actually need to work on these areas and get the body healthier in this area so that your body can work like it's supposed to. So this is it's painless. You get immediate results. We can actually print them out. You can take them home. You can show your spouse. I mean, hopefully your spouse is with you during this first visit if it's possible. But if not, you can show your spouse, say, hey, look, it's not my head. I'm having these issues. We need to get this thing dealt with. So that's what we do. So the first thing we want to talk about then is we're going to look at how does this all start? How does the body come together? And I know this gets like, don't lose me here. I know this can sound like boring and like Bill Nye the Science Guy, but it's really simple. So we have one cell. That one cell comes together. Mom and dad come together. It basically splits into one cell. That one cell splits into 2 cells, 4 cells, 8 cells. And this is called mitosis. And this is what it's kind of showing over here is, when mom and dad come together, that one cell is made right here. And as it starts putting those genes together, it splits into 2 cells and now 4 cells. And so basically, after we have trillions of these cells that are like coming together, that's the first thing your body makes, and it's your brain. And your brain has this God-given innate intelligence inside of it, which basically runs everything in your brain, which I think is super cool. Like, you'll see here in the picture where this guy's like touching a flame, right? And there's sensory nerves that go up into the fingers, all the way up to the spinal cord level, go up to the brain, go shoot back down into the brain on this lower picture here, shoot messages back down to say, hey, motor nerve, you're gonna need a motor to actually move those muscles, and say, hey, get your hand out of that flame, dummy, right? So that's kind of what we're looking at here is like your spinal cord and your brain is like this highway of information, and it's moving constantly. And this intelligence that, is in that system, it's telling things how to work. It's basically saying like, if you ate breakfast or lunch today or whatever it might be, your body knows how to digest it and remove the waste and use those vitamins and energy to like keep your nails and your hair good. And all these things are happening all the time. Like there's this amazing intelligence. We can't duplicate it. Like if you go to the hospital and you say, hey, I'd like to get my innate intelligence tested, they're going to look at you like you're crazy because that's not what they do. That's not their thing. But that is what chiropractors look at. We want to look at how is the body working? How do we continue to get it normalized? And to be quite honest, that's what chiropractic is about, is getting the body back to normal so that it works like it's supposed to. So let's go to the next slide here. The brain connects everything. So if this super highway from the brain going down into the cord is running all these little bitty nerves out and going out, and they're building every single thing here, your heart, your lungs, your muscles, your kidneys, everything, and then it runs it for the rest of your life, we want to make sure that it's clear. It's not irritated. So sometimes these things can get out of place, these little bones, and you'll say, oh, it's a pinched nerve. Well, yeah, sometimes these pinched nerves, we call them subluxations. Whenever that bone is out of place and it's pinching on that nerve, that's the technical term for a subluxation. I'm going to show you what that looks like here. So on the left, you'll see normal. These are the vertebrae. They're supposed to be nice and squared off. These discs in here are kind of like little cushions, and they keep those, when they're nice and thick like this, they actually keep those nerves off of each other. They're from being pinched. And so when it's subluxated, what happens is this bone gets out of place and it pinches on this nerve, and it makes it look kind of red here in this picture just to show you what it looks like. But that's not a good thing. Now you can feel it sometimes. People will say, oh, I feel this nerve running down my back or in my butt or down into my hand. It's causing like numbness and tingling. It feels like it's asleep. That's a pretty good sign you got a nerve problem. But my job is to find this and push those little bones back into proper position so that your body works again like it's supposed to. So you've heard me say this a few times, like function and disease and ease. And so this is kind of what we're looking at here. So if we look at this little spouse here, I read spouse instead of spouse. But if we look at this little picture here, it says brain to body. And that's what we want. We want this good connection from the brain to the body. When that's happening properly, your body's functioning like it should. And it's at ease. And when that's happening, we have a good environment for health to be optimized. So, that's kind of what we want is, it's basically saying, hey, if everything is lined up like it should, your body has the chance to be healthier. So when we look on this side, sometimes the body is malfunctioning, right? And then it's at a dis-ease. And that's a typical word that you'll hear chiropractors use, which means the body's not really at ease. It's at a dis-ease. Now, a lot of times when you put those words together, it's a medical word, right? They'll say it's asthma or sciatica or migraine headaches or whatever it is. And that's why chiropractors, frankly, we don't have to diagnose things. We can go along the spine, find where there's issues. We don't have to put a name to it. People come in with names to it, but I'm just looking at everything as a dis-ease. When we look at it, that's what it leads to, the body's going into a symptom state, and then people want symptom relief. But let's say you get symptom relief from a migraine, or from some sort of migraine medication, whether it's Advil or Tylenol or ibuprofen or whatever it might be. There's always a side effect to that, number one. And two, we've done nothing to fix the subluxation. So to me, it doesn't make a whole lot of sense just to take a pill or a potion or a lotion to cover things up all the time. Now, I'm not saying don't take your essential oils and maybe help your body relax and do things to help your body go back to a more normal. But what I am saying is if you don't take care of the subluxation problem, you're going to continue suffering. Now, how long do you want your wife and your kids and your spouse or whomever, your friends, your family, your coworkers, anybody to be suffering when they don't have to? If you can get that subluxation cleaned up and their bodies heal and do what it's supposed to do again, their body comes back, their life comes back. And that's what it's really all about, is getting people back to normal and giving them their life back. Let's go to the next one here. What can subluxations cause? Well, any kind of dis-ease within the body can cause the body to go into headaches, back pain, neck pain. And this is the kind of typical stuff you'll see chiropractors talk about. And they'll say, I have these issues. Can you help with these? Well, if they've watched this presentation, you'll understand. Probably if we have subluxation, yeah, we can remove that subluxation, allow the body to heal, work like it should again. And a lot of this stuff just kind of falls off on its own. So when I was going through chiropractic, or before I went to chiropractic school when I was in college, I actually had this one here, Bells Palsy. It's basically where half of your face freezes. And it's because I used to just kind of try to crack my own neck all the time. And that's not good because you're not moving the right ones. If it's number 5 that's stuck and you're moving number 4 and number 6, it doesn't make much sense. So, 20, 30 minutes later, you're going to want to do it again. And it's going to cause more issue, more arthritis, more problems in the neck. So, always go somewhere, go to a professional. Don't do this at home or have your uncle do it at the family reunion. It's not going to work properly. So, this here, a chiropractor is the only one trained to find subluxations. I see so many times where people, they just had to crack their own neck, or, like I was saying on the last slide, if you're not trained to do it, don't let people do it. It's not good. Sometimes, people ask me, well, I'm going to go get my medical doctor's opinion on this. I'll tell you what, if you want to get somebody else's opinion, go to another chiropractor, get their opinion. And you can ask your medical doctor, maybe they have some knowledge. And I'm not trying to bash on medicine or medical doctors when I say this, but it's not the right person. So I always give this analogy. It would be like asking your plumber about your roof shingles. Like, unless he was a prior roof guy, he's not going to know, how this really works. So their attempt and their approach on working on the body a lot of times is not from the inside out. They're not cleaning up the issues on the inside. They're giving you something externally, some sort of a drug usually, to block the symptoms or the pain. And I'm looking at that saying, let's work on things from the inside out. It just makes more sense. So even in the last couple of years, this video was made in 2022, and we've watched the medical profession look at, go home, put on your mask, and hide in your basement. I don't think that's the way to take care of things. You actually have to build your body, build it back to normal again. If it's sick, we have to build it. We can't just, hide. It just doesn't work like that. So how do we take care of people? We found that having people on a membership is the best way for your body can actually heal on a regular basis and get in front of it, because frankly, we all deal with stress. Everybody. If you're on this planet and you're breathing and you have a spine, your body is experiencing stress. And so we need to get your body regular. And so I tell people come in on a more regular basis. And we found that a membership is the best way to do that. So my family gets adjusted regularly. We might be once a week at this point because their spines are pretty good. Having a membership is where we see people get the best results they really want. It's absolutely true. It's even funny with new patients coming in because a lot of times I can tell immediately on a spine if they were laying face down and I go to adjust them. I'm like, ooh, this person must be new because they're so rigid and stuck. And that's what we have to do first is one, work with people on a regular basis, kind of more intensely in the beginning so that our bodies can actually start, adapting and doing what they're supposed to do. And then once we get them kind of cleaned up, then we can kind of, space those visits out a little bit. It makes more sense and it's easier to do it that way. So if your significant other isn't watching this with you, please send this page to them or this video to them so that they can actually see this. It's important so that they understand, why are you going through this care? And maybe it's something they would want to get their own spine checked. So we do have memberships down here. You can see those. These prices, can change. So, I kind of even hated to put them in here. I was a little hesitant, but we do have, individual and family memberships available. So as of right now, that's where we have our pricing. Let's go to this next guy. Insurance, why we don't mess with it. There's a couple reasons, but the big one is it's very limited. Insurance is great to have for emergency type of care. If you have an anaphylactic shock and you need to get into an emergency room, obviously that's obviously important. Don't come by the chiropractic office. Also, if you break an arm, something like that, these are medical problems. We got to work with medical issues and work with medical answers. Your insurance usually only allows like 8 to 10 visits a year, which kind of frankly isn't that great. As far as chiropractic care goes, it's not going to work very well. When it comes to some, a lot to put on down here, a pencil pusher in a cubicle in the middle of Wisconsin or something telling you or me how to handle your care, that doesn't go very well for me. So, when they're saying, if you only brush your teeth like 8 to 12 times a year, and we're going to tell you when it's okay and how often you should go, that just doesn't make a lot of sense. So we've basically eliminated the middleman. You don't have to, have insurance to come in. You do not need a primary. You do not need somebody to tell you it's okay to come here or write a prescription or something like that. This is all on your own. You can pick your healthcare. And that's the beautiful part about what it is we do and how we do it. We want to make sure that you're getting the very best care possible. That's why we see you like we see our own family. So if you have questions, concerns, I hope this answered some of them. But if you don't, if you're good and you want to go ahead and pop in, come on in, give us a call. We'll get an appointment set up for you. How long do we recommend coming? Well, like I said earlier, our first goal is to get you through correction. This means seeing you several times a week until your spine is holding a good position and you're functioning at the highest level. When that happens, we then transition you over to a maintenance plan. Maintenance is basically where you come in usually weekly, sometimes more. If you're having a rough week and you bend over and you go to pull on something and you're like, oof, that really got my neck. Well, I want you to come in. I don't want you to wait a week to come in at that point. I want you to come in. So that's kind of the whole point. I want you to come in regularly so that we can be in front of things. So how often do I recommend you do that? Well, from cradle to grave. If you have a spine and you're breathing, hopefully that makes sense that we don't want subluxations in the spine at any point in time. Whether it be a small one or a big one, if it's there, it's not good. So that's kind of the big idea of coming in here is coming regularly. Guys, like I said, if you have questions, comments, need anything, give us a call. The number is on the side here or above us, or however. I'm not sure where this video is going to be or where that number is going to be, but just give us a buzz anytime. More than happy to talk to you and kind of get you in the office and get you started. So that's it for today, guys. God bless.